Thousands of British ambulance drivers were expected to walk off the job Wednesday, joining an estimated 10,000 nurses who began striking the day before and adding to the unprecedented pressure on the British healthcare system. Unions point out that record inflation has eaten into employee wages. For nurses, that's made an already difficult job even harder.
Emily Leitch is one of thousands of nurses in London who is going on strike for the first time in her life. Her demands go way beyond higher wages.
I'm tired of coming into work and it being understaffed. I've got many colleagues that mental health is suffering, patients are suffering, and I want to see a change.
A sentiment shared by her colleagues who've walked out of St. Thomas Hospital. Their union, the Royal College of Nursing, is calling for better pay. It wants wages to be raised 5% above retail inflation. That would amount to a 19% hike. The nurses' union also want the government to fill a record number of staff vacancies, 50,000 in total, it says.
You don't go into nursing for the money, you go into care for your patients, but I feel like we're all at breaking point.
It's a similar situation across Britain. Here in Liverpool, nurses say they are overworked and underpaid. But recession-hit Britain cannot afford to match the nurses' union's demands, the government says.
Previously, on a nurse's wage, if you wanted to treat yourself for luxuries, you would work a bank shift or overtime. I find now that I'm having to work bank shifts and overtime just to make ends meet, and it's really difficult.
People are not managing. We've got a food bank set up in our trust that nurses and other staff members are having to access to feed the families. No, it's not enough. It's not enough.
Back in London, ordinary car drivers are honking to show support for the nurses' demands for better pay. When inflation is factored in, real wages for nurses dropped 1.2% annually between 2010 and 2017, according to the UK-based charity Health Foundation. Nurses are unlikely to drop their demands amid the ongoing cost of living crisis.
What do we want? Fair pay! When do we want it? Now! What do we want? Fair pay! When do we want it? Now!
Vicky Price is Chief Economic Advisor for the Centre for Economics and Business Research in London. Vicky, thanks for joining the show. I'm struck by the nurse we just heard who said that the shifts she once worked to have more pocket cash for luxury items or whatever she wanted to buy, she now needs to work them just to get by. Is this becoming a more typical story across the UK?
Well, it is. And what we're seeing, of course, is that inflation, like in other countries, has increased out of sort of anyone's expectations, partly because, of course, the war in Ukraine, and wages have not kept up with that. And what's going on, of course, across the economy is that real household disposable incomes are declining. They're declining by something like 2.7%. If you look at wages themselves, so there's, on the one hand, you've got this, the costs and tax increases that everyone is suffering from at present, but you've also got, of course, wages not keeping up with inflation. If you look particularly in the public sector, which is, where, of course, the nurses that we just heard work for, what you've seen is that they have lagged behind the private sector itself. So they've been rising by something like 2.7, 2.9% over the last year, when inflation, of course, is over 10%. The private sector has done slightly better. What we've seen there is that they're getting increases of over 6%. It's still not enough, of course, to make up for that gap in real earnings, but nevertheless, there is a gap between private and public sector, which has been increasing recently, and it's one of the largest that we have seen in ages.
Vicky, I've also read somewhere that the UK is still suffering from the Great Recession that occurred more than a decade ago. Would you say that's true, especially when you look at these public sector wages?
Well, yes. I mean, we had the financial crisis, and of course the UK was affected by that quite significantly by comparison to other countries, given the very strong financial sector that we had, and still have, actually. What it had meant, of course, in terms of what the government did to rectify, if you like, the situation, was enter into a big austerity programme. That austerity programme, through the decade that followed, meant that a lot of spending on public services was cut in real terms. And we are suffering in the National Health Service right now from those cuts. So it is an issue. And of course, the pay has not kept up with inflation anyway during that period when those cuts were taking place. And that's one of the grievances, if you like, that public sector workers now have, that they have fallen so behind that the increases they're asking for now, which look unmanageable by the government, are to make up for all those losses they've had all these years.
To what extent, if any, is Brexit also playing a role in these crises that we're seeing when it comes to wages, when it comes to rising prices?
Well, that's interesting because, of course, it has affected different sectors in different ways. So if you look at the economy across, the whole sort of area where particularly EU workers were very important, what you find is that there are sectors which have suffered quite significantly because of the exit, if you like, of people who were part of the labour force but decided partly after COVID, but also because of Brexit, not to come back or now find it difficult to get back and work in the UK. So the hospitality sector, retail, wholesale, quite a large part of construction in London in particular was manned by EU workers. So that has been a source of shortages, if you like, which have been seen both in the private sector, the areas that I mentioned, but also in the public sector, nurses, for example. So we have had conditions get worse for the NHS because not only do you have an increased demand because of COVID, flu, and everything else we've seen in the last few months and last couple of years, but also you have a shortage of people, which means that working conditions for the nurses and everyone who works in the National Health Service have worsened, or so they claim, and is part of what they're asking for. They want a change in the way in which everything is organised.
Vicky, I want to ask Prime Minister Rishi Sunak saying that the best way to help nurses and everyone else is to reduce inflation as quickly as possible. He also said that inflation will make people poor in the long run. That's not untrue. But what policy options does Downing Street really have to address this? Briefly, if you can.
Yes, well, they could raise taxes in various ways and pay for more of those increases. But it's absolutely true that inflation is an issue and needs to be dealt with. And people are feeling quite, much poorer because of what's going on. And we've seen that they have been keeping up spending but just deeping into their savings. So that's a problem. There's no doubt that inflation is bad news. But in terms of nurses and the public sector in particular, you could raise their salaries without having a direct impact on inflation because you're not going to increase the cost of the NHS to individuals. So you can't raise your prices. It's not as if you're talking about other parts of the economy where perhaps, the producers could pass it all on to the consumers. You can't do that very easily in the public sector. Yes. So the wage spiral coming from the public service increases in their pay is likely to be a lot less than in the private sector, except in areas like rail strikes, for example, the railway workers, where you could in fact see transport fares go up. But overall, they're much less inflationary than would otherwise be the case.
We'll have to leave it there for now. Vicky Pryce, the Centre for Economics and Business Research in London. Thank you very much.
Thank you.